A little cute baby with a deformed spine. It can be unnerving and nerve-wracking for the parents, and it's been an enigma for all spine surgeons across the world. Pediatric spinal deformity. I'm Dr. Abhay Nene. I'm a spine surgeon working with VR Spine, and I work on these little kids with spinal deformities. Essentially, spinal deformities can be of two varieties, congenital or acquired. The congenital variety is because of genetic defects that happen while the child is growing in the womb of the mother. It's not a very common condition and it can often be diagnosed with prenatal ultrasound. If it is diagnosed in time, you can sometimes treat or manage it, but more than that, it can set your expectations right. And rarely, if the deformity is not compatible with a normal growth, you can even consider terminating pregnancy if it's diagnosed early. Congenital deformities take a very different spin and they need attention because it's often related to multi-organ affection, kidneys, the heart, etc. And these children invariably need some kind of a surgical intervention early. Acquired deformities, that's the commonest group of the scoliosis that you see, which is the S-shaped back. Idiopathic scoliosis, for example, is 70% of scoliosis children have idiopathic scoliosis. The word idiopathic literally means we don't know the cause. These are growth-related deformities where the child grows crooked. The child is born straight, but during the adolescent growth spurt, the spine starts to rotate and starts developing a deformity. The treatment rules here are very clear that in adolescent idiopathic scoliosis, the condition is actually a cosmetic condition. It does not affect the organs, does not affect function per se, and it's really the cosmesis and the body image that drives you into treatment. In early deformities, plaster jackets, sometimes braces and exercises can hold it down. None of that can actually correct it, but if the deformity is of a smaller denomination, the kid could get away. So when I mean smaller, I mean in the 10-20 degree angle. Typically, a adolescent scoliosis that goes to the 30-40 degree angle tends to progress with age. And as the child grows, even after growth is completely completed, the deformity can progress. And these invariably require a surgical intervention. Once again, the requirement often comes from the patient rather than the doctor, because the bottom line remains that AIS, or adolescent idiopathic scoliosis, is a cosmetic condition. Not so with some other deformities. There are other deformities like kyphosis. Commonly, that happens after pediatric infection. Tuberculosis of the spine is one of the commonest cause of pediatric kyphosis, where there's a forward bend of the spine. This can significantly affect the neural structures, cause paralysis. It can affect breathing, and these require aggressive surgical management. To put it simply, most pediatric deformities are not preventable, barring the ones that come out of infection. They can be managed, they can be diagnosed early, treated early, and expectation settings can be done early. So there's a value in screening and identifying these early. In infection, there's a value in early treatment, which can actually prevent a deformity. But once the deformity is set, invariably the treatment is surgical. The good news here is that surgery for pediatric spinal deformity has come a long way, and now it's a safe and effective option. With all the due technological advances, we are able to give great results, and we have children who've had surgery for spinal deformity, who've joined back dance classes, they've pursued medical careers, and they're even doing marathon runs. So as far as pediatric deformity is concerned, it is an enigma for surgeons, it is devastating for the parents, but the solution is just around the corner. Cheers.